Do you have memories that have a lot of emotional weight? Have you ever wondered why? Why does this thing that happened so long ago still carry so much emotional weight? What would it do for you if you knew why? What would it do for you if you knew why some things were hard to heal? Would that make it easier for you to allow yourself to heal? Would that make it easier to take this thing that was traumatic and work with your therapist to have it no longer be traumatic? In parts of memory therapy, we come across something that we term as blockers. This is when we're going into a memory, we're taking out the emotions, and something stops this intervention, and it's still at the same intensity and it doesn't lessen. That's because there's a part of our personality that is blocking the intervention, hence the term blocker. What this is part of us that's afraid or concerned about taking the emotions out of a memory. Now that seems illogical, right? Like, why would we not be okay with being okay? That's what we're gonna have to figure out, or you, if you are experiencing that, that's what you are gonna have to figure out, because it is a thing. So, for example, what it might look like for someone is, what would it mean if this memory was a 0 out of 10? Would it mean that they're vulnerable? Would it mean that they're exposed to getting hurt again? Would it mean that they're not going to remember? Subconsciously, we have these concerns of, if this doesn't hurt anymore, then what? If this doesn't hurt, then is my guard down? Am I more vulnerable to getting hurt again? So subconsciously, sometimes it's hard to allow healing to occur because we want to protect ourselves. We want to make sure that we don't forget. Emotional healing is actually what protects us. If something scars over and physically we rub against it, it's not going to hurt as much. Emotionally, the same thing. If it's scarred over and we encounter something like that again, it's not going to hurt as much. We're not going to feel as overwhelmed. We're not going to feel as triggered. But sometimes subconsciously, we're thinking, this emotional learning, what happens if that's not there anymore? Well, what happens is it goes to cognitive learning. The learning's still there, the memory's still there, it just doesn't hurt anymore. This is where this is a goal of EMDR or parts of memory therapy, where we take the emotions out and it's just something that happened. But when there's this resistance, when there's this fear, that's part of our personality that's afraid of, what would it mean? What does it mean if this doesn't hurt? So what to do about that? If that's the case for you, you want to listen to that part of you. You want to find out what is maybe not okay with being okay. And you want to reassure that part of you. Because when you take emotions out of a memory, you don't forget. No, you don't forget. That memory's still there. The desire to protect yourself will still be there, will always be there. That doesn't go away. That part of your personality that's protective, that part of your personality doesn't go away either. Subconsciously, sometimes we need this reassurance that it's okay to let go of pain, and it's safe to let go of pain, and that it protects us to let go of pain. And by that pain being let go, that we are still safe, all the learning's still there. It's just we're feeling better. So if you're going through therapy and you're getting stuck, or maybe you're not going through therapy, maybe there's stuff that's just happened a long time ago that's still got this emotional weight, listen to the part of you that might not be okay with letting that go. Listen to that part of you that is afraid of it not hurting. What does it mean if this thing that you've gone through doesn't hurt anymore? Whatever comes up, whatever concern is there, you need to reassure that part of you. By reassuring that part of you, that healing is going to be much easier. So this is what we do in parts and memory therapy in order to make the intervention successful so that something is reduced to a 0 out of 10 on a subjective unit scale of distress scale. So I encourage you to be introspective, to listen to any parts of you that may not be okay with being okay, that may have concerns, and reassure that part of you. Healing and therapy is going to be so much easier if you address these things. So be introspective, see what you can find, and please click like, subscribe, send this video to friends, or just send the channel to a friend. I want people to feel better faster, and the more people that have this sort of knowledge, the better. Thank you for your time.